Iringa and Kagera are not near each other on the Tanzanian geographical map, but through the TUWAFIKIE TB project, we're able to unite them as neighbors with the same dream of reducing the spread of TB. Here, when we cough, we take it as a normal thing. We don't even take medicine. After coughing for 4 days, I realized this is dangerous. TB has remained to be one of the most dangerous diseases in the world. Recent statistics shows that more than 4,000 people lose their lives every day from TB, while 30,000 still get infected with TB, while it can be prevented and treated. TUWAFIKIE project has been implemented in Iringa and Kagera region by the Christian Social Services Commission, Cssc, with the intention of helping the fight against tuberculosis, bringing them closer to the different compounds in the two respective regions. And because fish is a rare food, it's important to start with Kagera region. After arriving, we knocked the door of the regional TB organizer's office just to know how the project was being implemented. In 2017, there are approximately 2,090 TB patients. 2018, we added more strength and had 2,214. And in 2019, we had more people coming to our region, especially new people, and they added more help in pharmacies. And we realized we have patients in places where they haven't been reached out to. Some don't come to get help because they think it's witchcraft, hereditary diseases, and some take a long time and hence end up losing their lives. But if we get a lot of patients earlier, more chances of helping more people. Now, Dr. Pasco's explanation made me start a journey heading to places where the TUWAFIKIE project has been implemented. The first district to reach was Karagwe, which surprised me how the pharmacies were used to identify people living with TB. By taking their cough, then take them to the hospital and other health centers for further tests.
Nilipolala usiku wa manane, nikaanza kukohoa.
When I slept in the wee hours of the morning, I started coughing. And when I coughed, I found out there was blood coming out. When my wife saw, she knew that I was gonna die. The TUWAFIKIE project uses important pharmacies, also known as DLDM, to collect samples of those suspected to have traces of TB. This is after the pharmacists of the respective pharmacies are given education on how to reach out to a lot of people.
These health centers, district referral hospitals, and private centers use a very long process, and it is expensive to treat TB patients. So people were staying at home because they were afraid of costs. People are dying before the TUWAFIKIE project. Someone tells you, my relative died like this. If you ask the medical history of the patient, they say yes, he was coughing before passing away. And he has infected me as well, but I couldn't go to the hospital because it was very expensive to just test. And when the results come, you don't have money for treatment anymore. So people have been dying, and TUWAFIKIE has done a great job to discover these patients from families and save a lot of people. People have suffered very much for just lacking of money.
Karagwe has seen many patients, and in all honesty, they wouldn't all be found or identified in hospitals. These patients would have spread the diseases in their respective communities, but they would have been hurting themselves as well. For some patients, it's hard maintaining your personal lifestyle and production at work, etc. It has made them find more relief in the work production, and later on, they say, I see light at the end of the tunnel, shining to a person who had already lost hope. I, as a person in the health industry, feel good when a patient is cured.
Naona kama nauona mwanga wa maisha yangu kwamba sasa unafunguka kwa mtu aliyekuwa ameshakata tamaa. Kwetu sisi kama watu wa binafsi, mimi kama mtu wa afya ninajisikia vizuri kwa sababu kupona kwa mgonjwa kwangu mimi ndio fahari yangu.
The one question you might be asking yourself is, those suspected to have TB, after their samples being taken, how do they reach the laboratories of the hospital or the health centers? Here's the answer. You go to the pharmacy store and you take the sample to Nyakahanga and get tested. When they're done testing, they call you in for your test results when they're ready and return the form where you get the samples.
Yako tayari, unarudisha zile nanili form, unazirudisha kwenye hilo duka ulilotoa sampuli.
Nimejifunza vitu vingi sana.
I've learned what TB is because I didn't know what it is, and now I know TB is a dangerous disease, but it can be treated. And even if I find someone sick with TB, I can advise them. So I have known that because of this work.
Hata nikuta mtu anauma kifua unaweza kumshauri bwana, hivi na hivi dawa zipo. Kwa hiyo nimetambua hilo, nimejifunza mambo mengi kutokana na hii kazi.
Hasa huu mradi TUWAFIKIE
especially through the TUWAFIKIE project has reached out to the society, not just a few. The plan to reach out to people has been implemented.
Tukimaliza kupokea makohozi hayo,
when done collecting the cough at the reception, we take it straight to the laboratory room where we have special equipments for storing the test, which is called safety cabinet. And after that, if it's positive, we have arranged a way of sending the results to the respective health center as quickly as possible. And even if it's negative, we still send it the same day so it arrives on time. After that, we send the hard copy. By using those transporting the samples by using boda boda.
Baada ya hapo, tunatuma hard copy kwa kutumia wale wanaosafisha kuleta sample na kurudisha ambao ni boda boda.
Kwa kweli hali ni nzuri.
Things are good. We have managed to reach out to a lot of people because in the beginning, we were getting the TB patients through the hospitals only, so we were only able to test the ones that were able to come to the hospital. But after increasing the efforts, the government in collaboration with other stakeholders, we have managed to reach out to more people even in remote areas. Through the TUWAFIKIE project, we start identifying patients from the pharmacies. So when they go there, they get educated about the diseases and get advised on how to get their coughs tested. And at the end of the day, we're able to identify more patients from those particular stores.
Na mwisho wa siku wakuta tunagundua wagonjwa wengi sana kutoka kupitia kwenye vituo hivi.
While Karagwe is impressing you with how they have improved in taking steps in diagnosing new TB patients, let me introduce you to Mama Jani from Muleba districts, whose hardships with TB was quite different.
I had a child who was sick. He came home from college coughing and vomiting. We took him to the Kaigara Health Center where he was admitted and released back home. We, however, had to take him to Chato Hospital after 3 days since his release, as his health didn't improve. After arriving in Chato, he was admitted, and when we explained to the doctor the history of where we came from, he said, "Let's put him on X-ray." Then they brought us results that he has TB symptoms. Then in a short period of time, I also started to cough. I went to Lokatari farmers, and when I explained to them, they said I should also go to test the sputum at the Kaigara Health Center. And after 3 days, they told me that I have TB, and then I started the dose.
Nikaenda pale kwa Lokatari. Basi nilipowaelezea, yule mhudumu akasema ukapime makohozi kwenye kituo cha afya. Tukawa tumeenda pale kwenye kituo cha afya Kaigala.
When this project started, we were able to compare the success. In 2018, the people we identified were around 230. But because we came in with intentions of educating people in the society, with respect that we involved leaders in the society, district council and other leaders in different centers, and given them all the requirements or knowledge of knowing a person living with tuberculosis. I mean, when you start bad, you end up bad. So after introducing the project, we went into societies the following year and were able to identify and diagnose 430 people, which is double the number. And if possible, the Cssc were able to run the project and not just do test runs.
Hivyo baada ya kutambulisha mradi tukaingia kwenye jamii, kwa mwaka uliofuata tuliweza kupata watu walioibuliwa karibia 430 na kitu. Kwa hiyo ilikuwa karibia mara mbili wakati tunaanza na mwaka ule ambao ulikuwa katika utekelezaji. Kwamba ikiwezekana hata Cssc wakapata fund nyingine waweze kuja sasa kwa implementation na sio kwa piloting.
Muleba District Council, through the TUWAFIKIE project, has been able to reach 400 new patients, which is more than their expected target.
Tuwashukuru wenzetu wa Cssc.
We thank our partners from Cssc in the plans that has helped us a lot. And because we make government budgets every year, and now we've gotten another chance to make another government budget which involves important health plans which we want to start taking into action now, so we proceed with them in the 2020-2021 budget. We have put more emphasis on TB in our plans as one of our priorities. Let me continue to give our remarks to our friends from Cssc that 4 of our other councils did not succeed in the plans. Bukoba Municipal Council, Kyerwa Council, Biaramuro Council, and the Rural Bukoba Area Council. We hope our partners from Cssc will find a way of adding these councils in the second phase. Efficiency has grown up to 114%, which means it's bigger achievement for people, which also means if these people weren't diagnosed, they would have died. If they wouldn't die, they would have spread the disease to other people. But through this project, look at the major success that has been found and have left great cooperation. Leave aside identifying patients. There is international relations, national relations between Cssc and churches and other religions as well.
Waone uwezekano sasa wa kuziingiza halmashauri zetu kwenye awamu ya pili.
Ufanisi umekuwa mkubwa.
Efficiency has grown up to 114%, which means it's bigger achievement for people, which also means if these people weren't diagnosed, they would have died. If they wouldn't die, they would have spread the disease to other people. But through this project, look at the major success that has been found and have left great cooperation. Leave aside identifying patients. There is international relations, national relations between Cssc and churches and other religions as well.
Kimataifa, ushirikiano wa kitaifa kati ya Cssc na makanisa, dini mbalimbali na shirika la kimataifa. Lakini kwa mradi huu tunasema tuendelee kushirikiana, tuendelee kutumikia Watanzania bila kujali dini zao, bila kujali kabila lao au uwezo wao. Kwa njia hiyo tusonge mbele tunapopambana kuingia kwenye maendeleo ya uchumi wa kati.
You might ask yourself, why is Cssc concentrating on TB?
Tuliandika andiko.
We wrote a proposal asking for funding to be able to implement various TB-related activities because TB is still a big problem in Tanzania and it's causing lots of deaths, and also people being sick from TB undergo a lot of side effects. We sent the proposal to TB Reach, who usually advertise for various organizations, to request for funding to be able to implement TB prevention initiatives in their countries. And now, TB Reach has opened Wave 6, which we have also submitted our proposal for TUWAFIKIE project, because we wanted to reach more people and join the national efforts in fighting TB.
za kupambana na kifua kikuu katika nchi zao. Kwa hiyo TB Reach walitoa Wave 6 ambayo na sisi tulipeleka andiko letu na tuliomba kwa ajili ya kutekeleza mradi wa TUWAFIKIE, kwa maana kwamba tulikuwa nataka tuendelee kufikia watu zaidi na kuongeza juhudi na kuchangia mchango wetu katika juhudi katika ngazi ya taifa katika kupambana na ugonjwa huu wa TB.
After enjoying fish and ugali in Bukoba, now I'm heading to Iringa, where the grandchildren of Chief Mkwawa here are telling me how the TUWAFIKIE project has reached the Iringa, Akilolo, and Mafinga Municipal Council, where the feedback has been positive.
To be honest, our region was in a very terrible condition before the TUWAFIKIE project. And since they arrived, they have done a lot of great things, and many TB patients have been discovered and the samples came in time from where they are tested. The project has been very helpful because many Iringa citizens don't like to go to hospital.
Na limesaidia sana kwani wananchi wetu wengi wa Iringa hawapendi kwenda hospitali.
There's a Swahili saying, every situation comes with its own benefit. Imagine if we didn't arrive here, this mama wouldn't know what was ailing her.
Nilianza kuumwa.
I started getting sick and I was coughing so much at night, and I was also very weak and very hot, and I was sweating a lot. I went to the pharmacy and bought some medicines and started the dose, but there was no improvement. The health attendant came and took me to hospital where they took my sputum, and when the results came, I had TB. I used the dose for 6 months and I started feeling better. Until now, I have gotten better.
Siku ya pili yake tena akaja akanipeleka nikaonekana na TB. Nikatumia dozi ile miezi 6 nikapata unafuu. Kwa hiyo mpaka sasa hivi naendelea vizuri.
Kweli huu mradi usingekuwepo.
Without this project, I would have infected a lot of people. And if other people knew if I have TB, they would have stigmatized me. So we are requesting that you continue taking care of us like this.
Kwa hiyo tunaomba muendelee kutuhudumia hivi hivi tuweze kutuhudumia kama zamani.
It is beyond reasonable doubt that the TUWAFIKIE project has helped to a great amount to increase the amount of essential pharmacies that are able to notice TB suspects and give them permission to go to other health centers for further investigation as compared to the previous state, which was happening in Iringa.
Baada ya kupata mafunzo,
after the training, anyone who come and say they're coughing, we ask for how long have they been coughing, and they would say maybe I've been coughing for 3 days or 4. Do you get a fever at night? We would ask, and they'd say yes. For how many days? Maybe a week or 2, they'd say. Do you cough blood? Sometimes they say yes. I cough blood at the end or at the middle. Now, after inquiring these questions, I ask them if I should test their sputum. If they say yes and agree, I tell them that your sputum will be sent to the hospital for testing, but we collect your results here.
Nachukua namwambia kwamba sasa unaonaje nikupime makohozi? Anasema niko tayari. Uko tayari? Sawa. Makohozi hayo sitakupima mimi hapa. Mimi nitachukua, nitakavyochukua nitapeleka kupima kwenye hospitali, lakini majibu utachukulia hapa.
Kupitia TUWAFIKIE project.
Through the TUWAFIKIE project, which was implemented in Iringa region for 1.5 years, it is a very short period, but we are very thankful. What we are requesting now is due to the good results we have seen in a very short period of time. We wish we can proceed in other remaining districts of Iringa region. And it should not be just for a year, it should be at least 5 years, because what we have seen at the end of the day is saving people's lives.
Jumla halmashauri 5 zote za mkoa Iringa, na isiyo mwaka 1.5 tu, ikiwezekana iwe hata miaka 5, kwa sababu tumeona mwisho wa siku ni kuokoa maisha ya watu.
The Christian Social Services Commission, Cssc, is a big institution that helps societies in different sectors like education, health, and etc. We have talked to the Managing Director, Mr. Peter Maduki, about the TUWAFIKIE project.
Katika hili tumefanikiwa sana kuweza kuwapata watu ambao waliweza kwa mfano, tulikuwa tumepanga pengine kwa kupitia hivi watu 37,800 ndio waweze kwenda, tuliwafikiri wanaweza tukawapata ili waweze kwenda kupimwa, lakini kufikia mwisho wa mradi takriban watu 59,147 waliweza kupimwa na kupelekwa na hawa wadau wetu wa ADO, na waliweza kupimwa, na hii ilitusaidia sana, ambapo yani kupimwa kule ninazozungumzia sio kule kupimwa maabara, yani ile kupimwa kwa awali, niseme kwa kuulizwa maswali ili kusudi baadaye uweze kumbaini kama huyu niweze kumpa referral au kumpa rufaa aweze kwenda katika hospitali inayostahili. Na kati ya hawa 37,800 tulikuwa tunataka watu 5,654 waweze sasa kupimwa kwa kutumia kwa maabara. Lakini tuliweza kufanikiwa, tulipima watu 6,327. Kwa hiyo ndiyo tuliweza kuifanya, na mafanikio makubwa sana, na tuliweza kupata wagonjwa zaidi ya 296 kati ya 296. Tulitarajia kutakuwa na ongezeko la wagonjwa ambao watakwenda kwenye kutibiwa wa 283, lakini baadaye tuliweza kufanikiwa tukaweza kufikia wagonjwa 296. Kwa hiyo utakuta kulikuwa na mafanikio makubwa kabisa, na kati ya wagonjwa 296 tuliowapata 290 walianza matibabu na waliendelea kwenye matibabu. Kwa hiyo kulikuwa na hali hiyo ambayo kwa hiyo mwishoni wagonjwa ambao walipona kabisa mpaka kufikia mwisho wa mradi huu tulitegemea wawe 109, lakini kwa kweli tulifikisha 139 ambao wagonjwa waliweza kufikia na kupona kati ya 108 ambao sisi mwanzo tulikuwa tunasema kati tutakaopata 283 basi 108 mwishoni mwa mradi wao wameshatibiwa na kupona, lakini Mungu ametusaidia tumeweza kufikisha 139. Kwa hiyo haya ndiyo malengo ambayo tuliweza kuyafanikiwa.
Reports from the Ministry of Health shows that we have succeeded a lot in the diagnosis and identifying more patients from 29% in 2015 to 53% till now. What does this mean for now?
Sisi ni wahanga wa TB kwa namna moja ama nyingine.
We are all victims of TB in one way or another. In the actual sense, there are 10 million TB patients around the world. In the 2019 statistics, more than 55% of the patients come from indigenous countries. WHO marked Tanzania as having 142,000 patients, but among those patients, the ones that we got were 82,000. This means we got patients that were estimated by 53%. Hence, we couldn't get 47%, and they're still immersed in the community, and they continue spreading the disease. Hence, we still have a major challenge reaching out to those with TB. With these statistics, it means we're still behind, and if you look at 2019, Dar es Salaam alone has contributed to about 20% of the patients, estimated to be 19,000, and other regions like Mbeya, Geita, Arusha, Mwanza, and Tanga, leading in having more TB patients. If you look at the bigger picture, these patients come from towns that are congested with people.